Corey arrived at the emergency room at approximately 8:34 p.m. on April 1st of 2021.
Yes.
And did Corey enter or was admitted into the emergency room at about 9:55?
Objection as to leading.
What time was Corey admitted into the emergency room for observation?
About 9 p.m.
Okay. And when Corey arrived at the emergency room, who brought Corey to the emergency room?
His mother.
And what was the chief complaint when Corey arrived?
Patient has some bruises all over the body. They want to find out where those bruises come from.
Okay. And when Corey was admitted into the emergency room, did you obtain the patient's history from his mother?
Yes.
Did you observe Corey?
Yes, I did.
And can you tell the jury what Corey's demeanor was when you observed him?
He was very scary, little bit scary boy, and he afraid to answer my questions.
Objection. The phrasing.
Of what, the question?
It's not descriptive. He's assuming what Corey felt.
It's overruled. The doctor answered the question. Judge, there's nothing.
Thank you, Judge. Was there also a resident who was working that evening with you at the hospital?
Yes.
And can you explain to the jurors what a resident is?
Resident is they are under the training to be a physician, full-fledged physician, so they have to go through with 3 years training. She is the general pediatric resident, so she usually come to emergency room, see the case, present the case, we discuss the case, and then we evaluate her, how good she is, whether she's going to pass the ER rotation or not. That is our job is.
And on April 1st, what was the resident's name who was assisting you?
Her name is Jennifer Sevilla.
And did you conduct a physical examination of Corey while at the emergency room at Jersey Shore?
Yes, I did.
And can you explain to the jurors what you did to examine Corey?
Okay. After the resident present the case to me, I went to ask that question again. I went to ask both patient and mother, do the examinations, and I discussed the mother what will be our plan for next 2 to 3 hours. And then I told the mother I will come and talk to you once all the lab results and imaging reports are in.
And how did you conduct the examination, meaning what did you do physically regarding the examination?
I did from head to toe examination, and then we marked down all the bruises, scratches in the diagram. I put everything in my chart.
Now, how were Corey's vital signs?
His vital signs are stable, and I'm not concerned when he arrived because of the vital signs are stable.
And can you tell the jurors about Corey's general constitution when you observed and treated him at Jersey Shore?
He's a small little boy. When I ask a question, he's scared. And
Doctor, I'm going to stop you there because you can only testify basically to what you did rather than what persons are saying. So can you just describe to us his constitution, meaning physically what you saw?
okay, physically, and we usually do head-to-toe examination. We go with system by system. So head-to-toe examination, we saw some bruises on the head, some bruises on the body, and some bruises on the back and legs. And Neurologically, we do the cranial nerve examination, basically neurologically intact. He has no neurological deficit. He is active, alert, and not in distress. And any signs of failure and chest examination within the normal limit, I did not hear any respiratory distress, wheezing, murmurs, hypoxia. He has nothing. And bar abdominal examination, abdomen is soft, no signs of acute abdomen. That means no tenderness, no pain, and no heart inconsistency by palpations. And physical general examination within the normal limit. All 4 limbs examinations, motor is intact, sensory is intact, saw only bruises, scratches. Other than that, we did not see anything.
So, doctor, all of your findings during this physical examination were normal?
Yes,
Okay.
except some bruises and scratches.
And what about Corey's lungs?
His lungs is clear, and as I mentioned before, no wheezing, no respiratory distress, no fast breathing, no hypoxia, and lungs is moving equally.
And you said that you had observed bruising.
Right.
And did the resident who you were working with document the bruising that she observed?
Yes.
And was this placed in the medical records?
Okay, let me take a look at it. We marked down all over the body, and we saw like some bruises, abrasion. The most significant one is on the chest bone area, like about 5 by 5 centimeter bruise. And rest of them are small minor scratch and bruises on the head, anterior chest wall, and legs.
So did you observe any scratches on Corey's body?
Yes, I saw some scratches.
And did you observe any abrasions on Corey's body?
Yes, I saw some abrasion.
Now, calling your attention to the abrasion, specifically marked as 2, can you tell the jurors where this abrasion was located on Corey's body?
Abrasion is on the left temple area, 1 abrasion, and another one on the right knee area.
And specifically, in regard to bruise number 3, can you tell the jurors where that bruise was located?
Yes, as I mentioned before, this is in the mid-sternum area. Size is like about 5 by 5 centimeter, circular.
And can you tell the jurors about bruise number 4, which was located?
Bruise number 4 is on the left side of the abdominal area. We call it flanks area.
And what about bruise number 5?
Bruise number 5 is at the left arm area.
And what about bruise number 6?
Bruise number 6 on the left elbow area.
And what about number 7? Can you describe that for the jurors?
Bruise number 7 is on the left, the extensor aspect of the left hand area around the wrist.
And what about bruise number 8? Can you tell the jurors where that was located?
Bruise number 8 is on the right side of the posterior aspect of the arm area.
And what about abrasion number 9? Can you tell the jurors where that was located?
Abrasion number 9 is on the right knee area.
And what about bruise number 10? Where was that located?
on the right legs below the knee joint area.
And what about scratch number 11? Where was that located?
Yes.
Observe any abrasions on Corey's body.
Yes, I saw some abrasion.
Now, calling your attention to the abrasion, specifically marked as 2, can you tell the jurors where this abrasion was located on Corey's body?
Abrasion is on the left temple area, one abrasion, and another one on the right knee area.
And specifically, in regard to bruise number 3, can you tell the jurors where that bruise was located?
Yes, as I mentioned before, this is in the mid-sternum area. Size is like about 5 by 5 centimeter, circular.
And can you tell the jurors about bruise number 4, which was located?
Bruise number 4 is on the left side of the abdominal area. We call it flex area.
And what about bruise number 5?
Bruise number 5 is at the left arm area.
And what about bruise number 6?
Bruise number 6 on the left elbow area.
And what about number 7? Can you describe that for the jurors?
Bruise number 7 is on the left, the extensor aspect of the left hand area around the wrist.
And what about bruise number 8? Can you tell the jurors where that was located?
Bruise number 8 is on the right side of the posterior aspect of the arm area.
And what about abrasion number 9? Can you tell the jurors where that was located?
Abrasion number 9 is on the right knee area.
And what about bruise number 10? Where was that located?
On the right legs below the knee joint area.
And what about scratch number 11? Where was that located?
It's on the left legs below the knee joint area.
And what about bruise number 12? Where was that located?
Bruise number 12 is on the right temple area.
Now, doctor, can you tell the jurors what your impression was regarding the bruising that you observed to Corey's body on April 1st when you had observed him in the emergency room?
Right. I saw like a multiple ecchymosis.
Let me just stop you there. What's ecchymosis mean?
Ecchymosis means there is some bleeding underneath of the skin for like a few hours to a few days.
And what other impressions did you have regarding the bruising?
Those bruises are in various stages, as I mentioned before. Some of them are maybe hours, some of them are maybe days. I cannot tell you exactly more than that.
Doctor, when Corey was at Jersey Shore, did you order blood work?
Yes, I did.
And was Corey's blood collected on April 1st, 2021 at approximately 10:49 that evening?
That exactly.
Yes?
Yes.
Okay. And was there a blood panel for an INR?
INR is the one we're looking for bleeding time, bleeding. Once there's a bleeding, we're looking for is there a lot of bleeding based on the enzyme level. That is the one we assess because the concern about bruises on the chest with different stages on the upper part of the body. So we are looking for is there any bleeding underneath of the skin.
And what about a prothrombin time? Was there blood drawn for that?
Yes, prothrombin time is a part of the assessment for the bleeding.
And can you tell the jurors why this diagnostic procedure was done regarding the blood work?
Because, as I mentioned before, we're looking for the bleeding, we're looking for infections, we're looking for the basic screening tests. Is there any problem with liver? Is there any problem with kidney? Is there any problem with infections? Those are the things we do this.
Regarding the blood work, did you run a panel for a CBC with a differential?
Yes, I did.
And what is a panel with a CBC with a differential?
Differential, basically, this is within the normal limit. I did not see any significant changes from the normal reference value.
So can you tell the jurors then what were the results of the CBC panel for the blood work which was drawn at the hospital?
Okay, basically we look at a white cell count. White cell count is 7.5. That means his result is within the normal limit for the white cell count. And we're looking for the red blood cell count, also within the normal limits of the 4.42. We look at the hemoglobin hematocrit value, 12.5 over 37.3. Those are within the normal limits. And platelet count is 329. This is also within the normal limit. If there is a lot of bleeding, platelet counts will be changed. And some other neutrophil, lymphocyte, monocyte, we look at it. Is there any problem, changes, abnormal patterns or not?
Doctor, what are neutrophils?
Neutrophil is a one type of the white blood cell fighting for infections.
And what was the neutrophil count when the blood was taken on April 1st, 2021, while Corey was at Jersey Shore?
Okay, neutrophil count percentage is 36.1. That is within normal limit. And absolute neutrophil count, that is what basically we're looking for infection if he has body resistant to fight the infection back. That's his absolute neutrophil count is 2.7. That is also within normal limit.
Okay. Did you also run a metabolic blood panel?
Yes, I did.
And what is a metabolic blood panel?
Metabolic blood panel is we're looking for the electrolytes, sodium, potassium, and as I mentioned before, basic renal function, basic liver functions, and...
Doctor, I'm sorry, could you just talk up a little bit? I'm sorry, I'm having trouble hearing you back here.
Okay, basic panel is we're looking for the electrolytes,
Okay.
sodium, potassium, and we're looking for liver function, we're looking for kidney function. They all are basic tests. Also looking for is the patient is dehydration or some other problems. Is there any abnormal electrolytes? Call it imbalance. Patient do not have significantly changes on his basic panel.
So what were the results of the metabolic blood panel then?
I look at it, all of those, my impression is he's slightly dehydrated. That is matched with the history. Patient was at home, I believe, spoke with the Child Protection Agency at somewhere around 11 o'clock in the morning. He didn't eat anything, he didn't drink anything. Come to emergency room about 9 o'clock. So like at least more than 7 to 8 hours, kid is not eating, not drinking. So that basic panel matched with the mild dehydration condition.
Oh. Now, doctor, how many times was Corey physically examined while he was at the emergency room?
3 times.
And why would he be examined 3 times?
This is our normal routine procedure. When the patient come in, resident see the first time, I see the patient second time, third time before patient discharge. I have to go back and do the examination again, review the lab result, review the vital sign, discuss with the mother, and let her know about the plan, what will be the next. That's why we have to do 3 times.
Doctor, at approximately 11:01 p.m. on April 1st, was there a skeletal bone survey conducted at Jersey Shore?
Yes, I did.
And can you explain to the jurors what a bone survey is?
Bone survey is we try to look for the skeletal and upper part of the body from head to toe. We do like a 19 radiographic examination, X-ray, scar X-ray, chest X-ray, abdominal X-ray, all the 4 limbs X-ray, looking for is there any rib fracture, is there any other mass, is there any other bleeding inside, or chest is clear. Those are the things we did.
And without telling us what anyone said, why did you order the skeletal survey?
Because we got a history saying that they want to make sure patient is not abused. So if we do the skeletal survey will let us know is there any previous fracture or any injury, because X-ray will show different stage of healing if patient has a broken bone. If patient has an acute condition, it will let us know about this. That is the reason I did skeletal survey.
So when a survey is done, about how many radiographs are done?
19 radiographs.
And radiographs are what, doctor?
Radiograph is X-ray.
And can you tell the jurors what the findings were regarding Corey's bone survey?
Yeah, his bones normal, and soft tissues are also normal. His lungs clear, and other part of the examination within the normal limit, and no evidence of acute fracture.
Was a chest x-ray done, doctor?
Yes, it does.
And what were the conditions of Corey's lungs on April 1st?
His lung is clear. We did not see any infiltration, any signs of injury. Did not see anything.
Now, based upon the physical examination of Corey, his blood work, and the bone survey, what was your discharge plan?
Discharge plan is at this moment, he does not have any acute emergency condition. He can follow up with the child abuse specialist. So we medically clear and discuss with the social worker, that is the child abuse team, and we discharge the patient to follow up with the child abuse specialist.
And was there an on-staff child abuse specialist at Jersey Shore?
Yes, we do.
And was he there the evening of April 1st?
He was not available
And why was he not available?
because this is a nighttime and weekend.
Now, based upon your physical examination of Corey, the blood work, and the bone survey, did you medically clear Corey for release from the hospital?
Yes, I did.
And was Corey ever admitted as a patient from the emergency room?
No.
And while Corey was at the emergency room, did you speak on the telephone with the DCP&P worker without telling us the conversation?
No, we did.
And based upon this conversation, was Corey cleared to be released to his mother?
Yes.
And Corey was discharged a little after 1 a.m., correct?
Yes.
So he would have been discharged then on the early morning hours of April 2nd
Yes.
of 2021.
Yes.
And when you discharged Corey from the hospital, did you observe any symptoms of sepsis or infection or broken bones or any of these things?
No.
No further questions, Judge. Thank you.